Nation will be your trusted voice for informed choices, meaningful conversations, and a vibrant life at every age. Though the Source TV radio network, it's known for its dedication to bringing the highest level of jazz content to the watching and listening audience, the owners of the network are also dedicated to bringing this important content to the fastest growing demographic. I'm deeply grateful to have this opportunity. So let's begin today's show. I'm going to introduce today's guest, Dr. William Smith, President and Chief Executive Officer of Aging in America. Aging in America was the parent corporation of AIA Supportive Services, a nonprofit, non-sectarian agency, which had under its auspices several long-term care facilities. And he served as executive director and chief executive officer of several of those nonprofit long-term care facilities. Since 2014, he's been planning the redirection of aging in America into the future. Dr. Smith has been in the field of social work since 1971, with the last 40 years dedicated to the field of gerontology, and he's been recognized both locally and nationally as an expert on gerontological issues. Dr. Smith is a member of the National Association of Social Workers, the Gerontological Society of America, the American College of Healthcare Administrators, and the Academy of Certified Social Workers. Dr. Smith has been instrumental in getting ECOSOC status for the International Association of Homes and Services for the Aging. From 2001 to the present, he served as the main representative to the United Nations for IAHSA Global Aging Network. In 2002, he was a participant in Madrid, accomplishing the Madrid Plan of Action on Aging. He's been a member of the UN NGO Committee on Aging since 2001, and he now serves as the chair of the NGO Committee on Aging and NGO Committee on Aging Executive Committee. So welcome, Dr. Smith. I am so thrilled to have you here today.
Thank you very much, Phyllis. It's great to be with you, and thank you for that fine introduction.
Is there anything that you'd like me to add or that I omitted or you'd like me to clarify?
No, it's fine. It's fine. All of my experience has been in the field of long-term care, and since the early 90s. So I feel that, I know long-term care quite well. I have developed housing programs. I've developed home community-based programs and maintained very good nursing home programs also. So it's the broad continuum of care that I worked in. From a public policy standpoint, through the UN, I've held national positions also with Leading Age, which represents 5,000 not-for-profit members around the country. Global Aging Network is the entity that used to be called the International Association of Homes and Services for the Aging. And that's where I assisted in getting ECOSAC approval at the UN and presented before the UN body to get approval. So it's been a nice ride, and I welcome our discussion.
So, because I am such an advocate for quality care and quality of life, and spent over 50,000 hours of my professional career as a speech and language pathologist working mostly in for-profit buildings, I have to address the fact that I have worked and I'm very aware of two of the buildings that were under your auspices that were not for profit. And indeed, they were quite different than any of the other experiences I had in for-profit buildings. So kudos to you for that. And we did not know each other then, but no. I was pleased to find out that you that those buildings were under your auspices when I was there?
Well, my whole professional career has been in the field with nonprofit services for older persons. And or very early after getting my master's, I actually worked in child welfare and provided services in another not-for-profit community. But most of my career has been in long-term care for older persons.
Yeah, but the nonprofit sector, as we know, in the for-profit, we don't have to get into that, but
Yeah.
it is certainly, they're two different animals altogether.
Well, the organizations I've worked with have always been mission driven. And you
Right.
mentioned quality care, and that's been really a pillar of our support. Even in my work at Leading Age in Washington, we had the quality initiative, quality assurance program. And that program really urged all of our providers to begin their services from the standpoint of quality. And then you deal with the financial issues and the building bricks and mortars. But you have to have quality as a main foundation to what you're doing.
Yeah, absolutely. I mean, that should be the driving force. And like I said, we won't go down that road. That's a whole separate conversation. But
Yeah.
I'm proud that I was in the buildings and had the opportunity to experience the nonprofits. So, you know, I certainly know that that dichotomy, we shall say.
Right.
But you know, I am interested in, because you are chair of the United Nations NGO Executive Committee, I'd like you to talk a little bit about that work. I'm sure, you know, people would be interested in that because it's quite extensive. I've been a member of the committee for just 3 years, I think it is now. So, you know, would you like to speak on that?
Certainly. You know, I chair the executive committee, which has about 14 members, and they are primarily women. However, we have gotten 2 or 3 more men to join the committee. And in almost all cases, the participants on the executive committee are retired and bring a great amount of professional wisdom and experience to the table. We are very active at the United Nations in New York, providing services in collaboration with DESA, which is the Department of Economic Security for older persons. And we do a lot of programming and educating around that initiative. The members of the executive committee, as well as the overall members of the NGO committee, do mission visits. They go out to different missions depending on what the issue is, and we try to educate them on how important it is to make sure that the reference to older persons is included in whatever language is before the UN. Most of the instruments that have been developed to date, or even the discussions, rarely, if ever, mention older persons. So we do really have an uphill battle because we know there are many, many issues that elder people can influence and support this.
Right.
And older persons themselves are very present to the UN through our branch of civil society. And it's important that their voices be heard. So some of us act as conduits to allow for older persons to make their pitch and to get across their point. And member states and representatives of member states, excuse me, they actually prefer to listen to the seniors themselves as compared to the hired guns, even though the hired guns are not employees. But it's a difficult job, and we continue to battle, and we're starting to see some breakthroughs. We're very aggressively participating in different commissions. We just had a 2-week session for the Commission on the Status of Women, and came out with some very positive results moving forward, where there will be, at the next commission, which is in about 2 years, there will be a 3-hour block of time on the issue of older women in terms of the status of women. So we're very, very pleased about that. We're starting to go ahead.
No, I was just going to say, and maybe you could just touch on this briefly. I don't know if people think about the rights of older people as a human rights issue.
Well, that's a very tender spot in our heart, because for the last 14 years, we many of us have participated in what they call the open-ended working group.
Right.
And that has been a labor of love, because the member states kept blocking us by saying there are many gaps that have to be addressed. So we addressed those gaps, and now we're moving toward hopefully getting a drafting of a convention. But even that's a long way off. But in 2004, in April, we were able to conclude the 14th open-ended working group and make a recommendation back to the General Assembly, along with about 10 other recommendations. But one was to move this work to the Human Rights Council in Geneva,
Right.
because we've done all we could do in New York. And now it's time for the human rights people to pick it up and carry it over the goalpost. And they're really making very good strides in doing this.
You know, it's interesting that you brought up the open-ended working group on aging, because when I decided to venture down this road and really educate myself about what was going on in long-term care because of my experiences. And, you know, when you work in any industry and in a particular area, you're kind of like in a cocoon, I would say. And I liken it to that. And then, you know, once I started really reading and looking into this and seeing that it was a national issue, I started doing a lot of research. And that's when I came across the open-ended working group on aging. And I was so thrilled to find out there was such a thing. And that was about 4 or 5 years ago. So somebody is just writing in here. My mother is in a for-profit nursing home. And this is a very sensitive subject. And we talked about it before we got on here. And I'm going to make a comment after this to tell you what I just did the other night, and is dependent on Medicare and Medicaid. I mean, this just chokes me up. I have to be honest with you. How will government layoffs and reductions in Medicaid benefits affect my mom? She has few other assets. So I like, you could hear it. I mean, I have tears in my eyes because this is so near and dear to my heart. But just the other night, I participated in a town hall, in a virtual town hall. And that was my question to the representative, which was, how is this going to affect all of these people in long-term care facilities who are dependent on Medicaid and who, you know, sign over their Social Security checks and Medicare? So you want to address that issue? Because
well, it's a huge issue, and it's one that's getting a lot of attention from our trade associations, like I said, Leading Age, NCOA, National Council on Aging, is involved. Many organizations, including the proprietary associations that represent for-profit nursing homes, are really lobbying against this, because a cut in Medicare and Medicaid — Medicare is the federal program, Medicaid is the state program, and each of those programs is different, but very necessary to the field of long-term care. I would urge every parent or every son or daughter of a parent who's a resident in a nursing home to be very close to the administration of that facility, be it proprietary or not-for-profit. There are very fine proprietary facilities. There are very fine nursing homes in the not-for-profit community, but we all have problems. There's no question about it. And, you know, most of our long-term care experience is taking place in the informal setup in the community, largely through community-based services, neighbors, friends, family members. But when it comes to a situation where it's no longer safe to keep a loved one at home, then they will have to look at alternate facilities that might meet their needs. But being a regular visitor at off times to a facility is critical. Make sure that your staffing does not get reduced wherever possible. That's the big problem with our state and federal money, is that 80% of our expenses are tied to staffing. So if they reduce the revenue to a nursing home from a state standpoint, or even federal, if they're in a Medicare stay, it becomes very, very difficult to hire staff and keep staff and give them raises as necessary so you have consistent care.
Well, I mean, I would say that short staffing is a pervasive problem. It's not new. And
Right.
I mean, I still do coverage in facilities for colleagues who, you know, are going on vacation, or, you know, the program is ballooning, and they need some help, on hands help. And I still do like to be tied to it that way. Kind of keeps my feet on the ground. And you know, so staffing is a problem now. It has been for quite some time, and so I can only imagine the impact that something like this will have. And you know, with it's very difficult for me not to go down that road in a conversation. But you know, my greatest fear, one of my greatest fears is, because people say the margins are low, and I don't want to get into that conversation because I have thoughts about that. But you know, because they say the margins are low, and care is already questionable in a lot of these buildings, I can't imagine how a reduction in that reimbursement to the building is going to affect the care that's already not at the highest level.
Right.
I'm trying to choose my words very carefully.
Well, I've enjoyed working in very fine facilities that have always left it up to the administration to provide a staffing that would be more than adequate to meet the needs of the residents entrusted to our care. And again, you start with quality. But the reality is, you know, we presently have an administration that is just simply reducing without really a big concern about the impact on that reduction in federal and state funding. And we're seeing it across the board, and that's very scary to me.
To me too. Somebody else just wrote in, and I'd love for you to address this because you have, firsthand experience from someone who that not only had facilities under your auspices, but also was administrator of facilities. What's the difference in services between for-profit and not-for-profit nursing homes?
I guess the single first difference is that, in my experience, nonprofit nursing homes have more staffing than the not-for-profit, than the proprietary nursing homes.
So correct me if I'm wrong. My understanding of not-for-profit doesn't mean that the facility doesn't make money.
Correct.
It just means that the bottom line has to kind of zero out.
Well, it means that the surplus that a provider would make would go back into the operations of the not-for-profit.
Correct.
And thereby allow you to afford more staffing. But getting staff to our facilities is very, very difficult. You know, ever since there was a real big crackdown on immigration, we lost many avenues of staffing that would come into our nursing homes, our hospitals, even our different community services, because those people couldn't get the visas and green cards to come on board. And as a result of that, you have people that are working 2 jobs in many cases.
Oh, sometimes 3. I've known people working around the clock. I mean, really around the clock for days on end. A, because they're needed, and B, to make ends meet because of the salary that isn't really so commensurate really with the kind of work that they're doing.
Right. Well, it truly is a labor of love, and we're looking for staff that really have an interest in working in this field. My concern is that the field has been the subject of many, many accusations and bad-mouthing and criticism. So how do you recruit people to come into this field when you continue to beat up the field? And this is a real concern even at the leadership level, at the administrators level. how do you encourage people to put their careers in this area?
So without going into, well, maybe we should go into this because you have been a director, because I'm very passionate about people understanding how to be a leader, how to encourage people under their direction. As a matter of fact, just today, I responded to a post on LinkedIn that talked about leaders who really try to, um, exert, extreme control, and thinking that that's the way to manage, when the reality is, my comment was, and it was a really very insightful, it was saying the way that that's not the way. And I was saying that, if, my experience, if you want to use the metaphor um, of a horse, when does a horse really have the freedom to run? Is when you loosen the reins.
Yeah.
And that's really when you have a staff that can be productive and creative and feel that they can work with one another. Otherwise, you create such tension in a toxic environment. All people do is complain to each other about their job. So how would you address that issue as a
Well,
who,
first of all, you have to be aware that the field of long-term care is tremendously regulated by state and federal government,
right.
even to the extent of being more regulated than nuclear energy. So you can see the level of requirements that we have to deal with. And all the staff that are licensed have their license at risk in terms of being in compliance with those regulations. But I do believe that as an administrator, we have an obligation to train people and to develop people and to put money in our budgets for training. Leading Age, again, the National Organization for Not-for-Profits in Washington, has a whole institute just on how do we train new administrators? How do we support them? And how do we link them with other seasoned administrators? You can't do it by yourself. You have to be in collegial relationships with other peers. So there are some of those meetings are critical. My own technique as an administrator, and I've done it for many years, I start to tell people I'm now older than dirt. But anyway, is a slogan of MBWA, management by wandering around.
Oh my goodness, I have to interrupt you because I wrote about that, and I think my second book. So I'll tell you about an owner that had this wonderful way with the people who worked in his building. So tell me about it. I wrote about that years ago. I'm so thrilled to hear you say that.
Well, it's great to get out of the office, and I encourage all of my senior management to go around. My HR director, my food service director, get to know the staff, meet them, get to know their good points and some of their concerns that they have. Many of them are working, like we said, 2 or 3 jobs and have families. And how do they handle that stress? So if you reach out to them and in a caring way, they will respond to you. I've been out of one facility for almost 20 years now. And when I go back to that facility, I still know some of the staff that are
Right,
still there, and they know me. So
right.
we have a discussion. We talk about their children. We talk about that. But that's the type of dedicated staff that you want. And it's just a real, it's a vocation working in the field of long-term care.
So I'll tell you about this. I just mentioned it, and then there's another comment, and then after that we'll go to break. And I want to kind of talk about some other things from the United Nations Decade of Healthy Aging. So this particular man was an owner. Okay, I'll say Mr. A. I met him. I was working, this is many, many years ago. I think it was the early 2000s. He was the owner, as I said, not the administrator. And one day he came up in the hallway and he said to me, hi, who are you? Which is unusual, had been unusual up to that point. And I introduced myself, and he told me who he was. He was the owner. And we spoke briefly. As he walked away, I watched him. And he stopped and spoke to staff members, residents. I came
Yeah.
to find out, because I was fairly new to that building, he did rounds in that building with the administrator 4 times a week. He was in every unit. He
Mhm.
knew every person who worked there. He could say, gee, how was your mother? How was your son's
Exactly.
graduation, your vacation? He knew the residents. So, of course, he had tremendous loyalty. And look, I'm still talking about this like 20 years later. I'm still talking about this man.
Yeah.
And I don't understand, if people know that that's successful, why they don't do that. I'm sure you're not the only one. He's not the only one.
Right.
Why don't they do that if they know that that's going to bring them, a better workforce, really?
Well, it depends also whether or not they have the resources at their disposal to fund the other budget needs that they have, to fund the staffing needs that they see as being important.
Yeah, but I mean, just in terms of walking around and talking to people. So I'll give you an example. I was covering in a building in no, it's not in Westchester, it's in Putnam County. And I've seen this administrator walk around the building. I haven't really seen him talk to many people, but he
Mm.
walks around the building. So there's a difference between walking around and walking around with the intention of engaging with people, which
Right.
makes a very big difference.
Right. Well, I actually have had the experience of working with nurses who are medication nurses and who are providing, you don't want to interrupt a medication nurse
Right.
because that they are really doing very important work. But I've actually reconciled medications for individual patients. So I know how to read an MAR, medical administration record, and see whether or not the drugs were appropriately
Right.
sent out. And are you dealing with terminated medicines? So,
Right.
you get to pick up different skills based on your interests. But
Right.
it's
Right. Right.
more than just meet and greet. It's really recognizing the extreme pressure that people are living under in this environment of long-term care. And it's a noble career. It's
I
a
agree.
noble work.
I agree. So this is another comment that came in. It said, I'm 84 and fearful that cuts for medical research can lead to nursing home epidemics because of vulnerabilities and indiscriminate decrease in Social Security staffing. I won't get an indiscriminate decrease in Social Security staffing. I won't get my Social Security benefits on time. I will not be able to continue my residence at the excellent assisted living facility where I'm currently a resident.
Well, the best thing to see there is that it's an excellent assisted living facility. I'm very pleased that the person who lives there sees that. And
Right.
then they should really cozy up and get to know the owners and the administrators of those facilities. And, first of all, yes, there is a reduction in Social Security staffing. We're already seeing the closing of some offices, but we're not seeing the reduction in funding to the seniors at this point.
Right.
And if we are, then you pick up the phone and call your congressman or your congresswoman and senator and get them on the board. Don't try to work this out by yourself. Medical research is being cut, and it's a tragedy because there's so much that we need by tracking illnesses and doing research that is going to go by the wayside with these cuts. And that's a problem. But, we just have to keep battling. I feel like we're Don Quixote with the windmill, trying to hit everything that's coming across the board at one time. But I think, we have to get to know who the Social Security people are in your community. And then,
Yeah, absolutely. So I think this is probably a good time to take a little break, and we'll be
Fine.
right back. And then when we come back, we'll continue this wonderful, stimulating conversation. So thanks an awful lot.
Thank you, Phyllis.
We'll be right back. You are listening to Source TV Radio Network, WTSN Washington, D.C. Your live streaming all access pass to the arts and entertainment around the globe. Live streamed with global reach and stunning streaming to over 16,000 terrestrial and internet stations, reaching 160,000 DMV viewers and listeners weekly, over 3 million across North America, 38 million globally, in over 165 countries monthly, making Source TV Radio Network one of the highest independent media streaming stations on the East Coast. The network provides listeners with jazz crossover, R&B, and old school music from some of the most renowned artists. Jazz has all but disappeared from radio, but not on Source TV Radio Network. And don't forget to tune in to the Jazz Confusion Power Hour, Thursdays at 7 p.m. Eastern Time, featuring some of the most talented rising new artists and legendary jazz, R&B, soul artists anywhere. Source TV Radio Network, WTSN, Washington, D.C. Okay, welcome back.
Okay.
So, Bill, as I said earlier, I wanted to touch on the United Nations Decade of Healthy Aging.
Very good.
I actually just received an email from the UN NGO Committee on Aging about the UN Secretary General's report for the upcoming 58th session of the United Nations Commission on Population and Development that dealt with ensuring healthy lives and promoting well-being for all at all ages.
That's a invitation for everyone to really participate in the next commission, and it's a very, very important commission. The decade of healthy aging really goes from 2021 to 2030, so we're right at the midpoint now. But we know that the population around the world is growing just geometrically. And we also know that the longevity of our older persons is extending. So we're seeing a big difference in the pyramid, which used to have a lot of young people below the pyramid supporting the older person at the top, where it's being inverted in some cases, some countries, or becoming thinned out. And we don't see the number of workers no longer contributing toward their states or governments to support that higher end, those needs. But the UN Decade of Healthy Aging is a critical piece because we're dealing with age-friendly environments, which are better places to work, to grow, to live, to play, and to age. And that is really what's important. And you only hear positive things when we talk about that. We have to realize that for the most part, our older persons are not dependent on countries or governments to survive. Many of them, 15%, are in long-term care facilities. We know that.
Right.
But 85% of them are living in the community, some of them independently.
Right.
And, so that we have to support that independence any way that we can. We get conflicted when we start looking at some of the aging issues. We want to encourage healthy aging. We want to encourage exercise. We want to encourage, different types of medications that would help you continue to be independent. And, it's just it's a whole host of things that we have to work on.
Another question just came in, going back to the long-term care issue for a moment. And the question was, what is the best country to live in for long-term care?
Well, now, if I had that answer, you and I could both retire. I have had the experience of traveling in other countries and looking at long-term care. And, you know, the services that we have here in the United States are really quite phenomenal. Through our institutional facilities, through our home and community-based services, through our office for aging services in each of our states, through our federal support, even though it's under attack. But we do have a lot of services. You know, at the UN, there are many conventions that have been initiated, like the Convention on the Rights of Children. And many states will support that, and they'll pass the resolution. But there are some countries, including the US, that hasn't signed on to that convention. Because
Really?
they have the position, they believe, as they do with old age issues, that the US provides so much more services than what would be required by a convention, and the US doesn't want to force other countries to have to budget money to take care of their older persons. Well, there are some of us that want them to stiffen up their back and just do the right thing.
Right.
Yeah,
I didn't know that.
It's a complex issue, but so that even when we get to convention, we now have 194 countries at the UN that we have to get them to sign in on. And hopefully we get it through a consensus building document, not by individual up or down, because that becomes a real problem. But go ahead.
Go ahead. I had a comment, but no, you go ahead.
So I think that what other countries, I've been to some countries that think they have great facilities. I was in one country, and the organization I worked with at that time had fellow nursing homes or other nursing homes in that country, and I visited them. And frankly, my impression, they were good quality care, but the seniors were all sitting around the corners of the room. There was little activity, and frankly, the nursing homes looked like they were built in the 50s. So, and that was a good nursing home.
Wow.
Just came back from a trip in Hong Kong, and I gave some remarks there, and I did some tours, and a rather upscale nursing home or assisted living facility had rooms that were set up for individuals that were no wider than 6 feet by 8 feet.
Oh,
and
wow.
that was the living quarters for that senior. They did have some socializing rooms on the unit. They had some dining rooms, but that was a high-end type of facility. Now, if you come to any of our high-end nursing homes or continuing care retirement communities in the United States, you see a lot more space, a lot more amenities, a lot more support, and stuff that will help stimulate the brain to keep people as independent as possible.
True. So I have two things, and I think it's Thailand, but I don't 100% remember, but I think it was Thailand. I'll have to look it up and maybe clarify that on a future show. But somebody had sent me a little video of a continuum of care community. And like I said, I think it might have been Thailand. Anyway, it was unbelievable. It was the most unbelievable thing I had ever seen. And it also had some long-term care beds or a section. It was remarkable. The difference there also is it had the space for it, know, the land appropriation. So that also becomes a factor, especially, let's say, in cities, they wouldn't have that. But in all fairness, I'm sure you know about the greenhouse model.
Yeah, Bill Thomas is just a champion of the
right.
greenhouse.
And actually, I'm trying to get him on the show. I've interviewed him several times before.
He's great.
We're good friends. He actually wrote the foreword to my last book.
Nice.
Dignity and Respect: Our Aging Parents Getting What They Deserve. He's an incredible guy to talk to, as you well know. But the first urban greenhouse, actually, the Leonard Florence Center for Living, which is in Chelsea, Massachusetts. I've been there, and it is really an extraordinary place. And how that was developed, Barry Berman, I think is his name, the CEO. I think that's his name, if I remember correctly. So he was administrator of a nursing home called Chelsea Jewish, maybe. Anyway, he was administrator of this home, and his mother had a stroke, and he moved his mother into the nursing home. And within a few days, he couldn't believe what happened to her. It was just a horror show for him. So he had the means. He could bring her home and provide her the care she needed, but he went about transforming that facility to make it as much of a greenhouse model as he could. Because that does require some, modifications in different ways of the building, the structure. But he did what he could. I forgot. I think he raised 9 million, 19. I don't remember now. I wrote about it. Yeah. I visited Chelsea Jewish. It was quite a place. But then he went about, I think it was for the Leonard Florence Center of Living, I think he raised $19 million, and he built this place from the ground up. And have you ever been there?
No, I have not seen
it. It is worth the trip. It is extraordinary, absolutely extraordinary thing to see.
Well, the model that Bill Thomas really has developed through the years has evolved, and it really is now even being used on different units in high-rise facilities in Manhattan.
Right.
Jewish Life Care has a couple of units that follow that model. And it's a matter of being just adaptable and allowing people to have some participation in their future years, whether or not they participate in cooking or participate in activities, they can continue to grow. And even though they're in a facility. So it's a very, very, I strongly recommend anything that Bill Thomas is doing as just being fantastic.
Yeah, no, it really is. Actually, he's gone on to do something. Like I said, I'm trying to schedule him to be on the show. He's a busy guy, but to talk about the communities that he's developing, which are intergenerational communities, and they're really quite fantastic. And I actually was working on a film project that was based on 2 of his novels, actually. And I've rewritten the story a little bit, but it was inspired by his books. And just today, I was thinking about what the title of the film should be, because I've changed it a few times. It's a working title. I'm just getting the script finished this next couple of weeks. And I said, gee, maybe we should really call it the name of the community that he's developing that inspired, me to think about this film. And that's Kalimos. And Kalimos communities are becoming a reality where people of all ages live together in a community setting, not in a facility setting, in a community setting.
Right. Well, and that's being carried out in a number of ways, in terms of age-friendly environments. Many municipalities are being much more sensitive to their aging residents. They're actually setting up sitting areas along sidewalks for people to take a break, to take a rest, to encourage them to walk, but to have that amenity. Curbs that are certainly able to be recessed so that seniors can get up without tripping and breaking their necks. It's the little things, having trees that allow for shade. It's important that we just look at everything and involve the seniors in what they want to see in their environment.
Right. And especially as more people will want to continue living at home, to continue living in their community, so they don't have to, go into that kind of long-term care facility, which, a lot of people find distasteful at this point. And, and maybe this is something that you and I could also briefly discuss. people make promises. I was just talking to a couple that I know, and her sister moved in with them who has advancing dementia. And I was coaching them on the fact that, and many people that I know, people think that they're going to be able to continue this, and maybe they will, but maybe they'll come to some point when they won't be able to. And people have the best of intentions, but it doesn't always work out that way. And so, but more people are wanting to live at home, are wanting to stay, in the community, even with home health services where people take them out into the community. So this is very important, what you're talking about, age-friendly communities, which are also, by the way, not only for older people, but for younger children who can't pick up their foot to step onto a curb. And, it involves so many ages, actually. But yes, for the older population, it's especially important.
Well, it becomes more and more important. I had a conversation myself on Sunday with very dear friends of mine. Their son-in-law is now in a position of where he has to bring his mother up from a southern state to New Jersey. And what does he have to do to make that happen? Now, he's a bright guy. His family, his kids are out in school now and doing well. But it's a big adjustment. And there, in that case, the resident has dementia. Right. And it just becomes difficult. She's not combative or anything, but she is deteriorating. Right. And and she's presently living with a sibling of his who can no longer provide that care. So you can see how disruptive this is to both people that are taking care of the mother and the son who was trying to receive the mother. And, I basically advise people that you do the best you can. Do not heap guilt on yourself.
Correct.
Just do the best job you can in providing the best safe environment for your loved one. And there are resources available, and that's why they had the conversation with me, so I could direct him to some of the resources that I'm familiar with. Right. And, so we get those calls all the time. But we know that with dementia, over 55 million people have dementia worldwide, over 60% of whom live in low and middle income countries. So that's very dramatic as compared to what this country is dealing with. And yet, when it's your loved one who has the dementia, that's all that you're really concerned about. You're not concerned about the other 54 million. Right. But it's really very, very different.
Well, actually, isn't this, I don't know if this statistic is still applicable, but it used to be that every 65 seconds, somebody in the United States is diagnosed with Alzheimer's. I don't remember what the statistic is worldwide, but going back to what we were talking about, funds being cut, one of the things being cut is Alzheimer's research, which is really a travesty.
Yeah. Well, we know that Alzheimer's disease is largely equated to 60 to 70% of cases of individuals with dementia. Right. So it's very big, and it's not curable. Right. You can introduce some factors to reduce the symptoms, but it's important that you be aware that it can be a terminal disease.
Right. They are now referring to Alzheimer's as type 3 diabetes. And I'm hoping to have someone on as a guest who can really address that in more depth and answer those questions. I mean, somebody just asked me about it. A young fellow just asked me about it Saturday, I think it was. Yes. Just asked me about it. And my hunch is, he, I think, is probably in his 40s. So I will see him again this weekend, probably. And I'm going to ask him what prompted him to ask me that question, if it's somebody he knows, somebody in his family. So another question just came in.
Just before we go on to that question, dementia is currently the 7th leading cause of death. One of the major causes of disability and dependency for older people globally.
Oh, wow.
So it's a huge, huge issue.
So this says, this comment says, I live in Atlanta. My mom lives in Utah. Is she better off if I leave her in Utah where her friends are but no family and look for a nursing home there, or bring her to Atlanta so that she is closer to me? So before you answer, one of the things I tell people is that, because you said about going to visit and making yourself present, that I think a lot of people think that once they move their loved one, whoever that is, into that kind of environment, that, you know, they could go and visit every once in a while if they choose to, and that that's sufficient because they'll get care. The reality is the absolute antithesis of that, that the reality is the more present you are, I hate to use the word the squeaky wheel gets the oil, but the reality is, and you can address this, the more present you are, the more visible you are, the more vocal you are, that's going to translate into your loved one really getting better care. But can you answer that, please?
Well, first of all, it depends on how comfortable Tom's mother is in Utah. If she's in a protected environment and she's comfortable and she has good support with her friends, I wouldn't necessarily uproot that. Family may have to increase their visitation out to see her, might be a way of handling it. And then if in fact that support system starts to break down, then you would look for bringing her closer to you.
Well, I'm going to, I have a little bit of a different point of view. Let me just tell you.
Go ahead.
Based on very recent experience. So I was traveling upstate New York, about 3.5 hours from me, to help out this facility for most of 2024. I was going up there every couple of weeks and staying for 8 or 10 days. And I became friends with a woman. She actually and I are very good friends now. And her mother was in that facility. She lived about an hour and a half away in Syracuse. And but the reason she thought she would leave her mother in this building was because this is where she grew up. Her mother lived there. Mother actually lived 5 minutes from this building. She felt it was important for her to be in that community because in that particular small town, everybody knew each other, was related to somebody, knew somebody. You couldn't get away from it. But as time went on, and she would travel there once or twice a week to see her mother. And in addition to that, she hired somebody to go in once a week and spend time with her mother. However, the care was dwindling. I actually coached her in doing some things that did help. But ultimately, she had asked me what she should do. And I had suggested, it actually is in an area where Bill Thomas transformed the first nursing home in New Berlin, New York. It was right near there. So I had suggested to her that if she can find a place similar to that closer to her, it might be better. Well, it took her a little while. As it turns out, she did move her mother closer to her.
Right.
And it is a smaller environment. It's kind of modeled after a little bit like the greenhouses. Anyway, she wasn't concerned initially because her mother was around family and friends in that other place. But what she has found now is she's closer to her. She can visit more often. She's more visible regarding her care. You know, every once in a while, she'll ask me questions about things. She could go in and discuss it with them. And because it is a smaller environment, more home-like, her mother is thriving. She's doing better. She's more consistent. She's less confused. So my response to this person is kind of what you said, but also because I feel it's so important for people to be visible, I would think it might be better to move the person closer to where if I could be there more often, I would think that would be the better choice. But, you know, we have two different things.
But you have options. And that's
yes.
the point. And you want to always, well, what does mom want?
Right.
What does she want, by the way? You know, even in the field, if she does have some dementia, you know, what are her desires? And you play to the moments of lucidity. What does she really live? Is she's comfortable where she is? Do you really want to uproot that? Now, chances are it'd probably be better all around to have the family unit closer together. But you really have to examine that family unit to make
That's a
sure
good
it can
point, and
handle
I
it.
didn't even mention that, which is crucial in terms of autonomy. If his mother is still lucid, if she can have, be part of that conversation
Yeah,
and part of that decision making, because what a lot of people find, older people that are in these environments so difficult, is that they're uprooted. I hate when, or I should say I have objection when people say, I put my mother in a place, or
yeah,
I put my father, because it's like you put a bag of flour on a shelf, but you
yeah.
don't put a person someplace. This is a person. And so that's a very good point. I can't believe that I didn't even bring that up, but that is crucial. If she has that ability,
Yeah.
or if
And
you can
and
have
just
that conversation.
yeah, just a clarification. She may not be alert and oriented to everything, but you want to play to the moments of lucidity.
I agree.
And don't hassle her that, oh mom, I have to tell you again.
Right,
We just talked about this, but
right,
rather look at, well, what else can you do? How do you redirect that person?
right. I mean,
You
that's
know,
a whole other conversation. Maybe
yeah,
we could have that conversation another time, because as a
yeah,
speech and language pathologist, a dementia care specialist, I've certainly done a lot of that. And I was just coaching my friend on what they could do with, her sister living in their house when they encounter these different um, responses. And I'm careful not to use the word behaviors, because there are really no dementia behaviors, as you and I know.
right.
It's really a response, and people don't always understand that. But we're almost coming to the end of the show. I mean, how would you like to sum this up for people, and for your role in the United Nations, if you think that's important? Or what would you say are the biggest takeaways for someone from this conversation?
Well, first of all, there's a huge amount of research available to anyone online to go to the UN website, to the NGO Committee on Aging, or to DESA, DESA. Go there and look at their research that's online. There are all sorts of reports that are available that would help this issue. I think another point would be that we're all unique, and there's no one good plan for everyone. So you make the best plan you can based on your loved one's um, background and their experiences, and what are their disabilities at this point, and what are their wishes. You don't want to take away their rights. We're
Yeah,
very
I
big
agree.
on developing rights, and like I'm like I said, I was older than dirt. I'm going to be 76. And, as I look at where do I move from here, it probably will not be to a very good CCRC. I
Right,
probably want to be independent in my own housing situation where I don't have to do outdoor chores. So
right,
that's my role, my goal.
right. So,
But I don't want people to tell me what to do or where to go.
right,
And we saw enough of that with the pandemic,
right,
and it was very, very damaging here in New York.
right. So, can you clarify for people two things, if you don't mind, what NGO is? I mean, I know, but
It's
clarify
a
for listeners.
non-government organization.
Right.
NGO stands for non-government organization, and the Committee on Aging is located in New York. There are three main points for the UN: New York, Geneva, and Vienna. And the chairs of these executive committees, myself and my two colleagues, meet every 6 weeks or so online to discuss what we're doing in New York, what they're doing in Geneva, what
Mm,
they're doing in Vienna. And
right.
we're very candid. So it really does bring our UN global issues closer together.
And then you mentioned CCRC. I know what it is, but can you?
A continuing care retirement community. And these are all fine options. Some of them are very expensive. And, some of them are you pay to go in, and then you have a return when and if you leave. Some of them you don't have a return. So everyone is a little different model.
Right,
But I'm a strong supporter of Leading Age in Washington, D.C. Look on their website. There's a wealth of information there. There's a wealth of information on training new leaders for our facilities in long-term care.
Yeah, and I just want to say for people that CCRC, a continuing care retirement community, usually has independent living, assisted living, and then has a third level, which is like a nursing home, long-term care, but not always, because I've worked in a CCRC, where sometimes, let's say if you are in assisted living and you fall and something happens to you, or you break a hip, or you need some rehabilitation, you can move into this, skilled nursing, long-term care environment for a period of time, and then get rehabilitated and move back to your apartment. So, I mean, there are real advantages for CCRCs from that point of view.
As long as you can afford it.
As long as you can afford it. So I think we're coming to the end here. So, I just want to say thanks, Bill, so much for joining me.
You're welcome, Phyllis.
The breadth of your experience, your insights, your knowledge is very important for listeners and for viewers. And, it's just, I'm thrilled to be part of the UN NGO Committee on Aging.
Great.
For me, it's only been 3 years, but I look forward to, I'm behind you only by a few years, so I've got a ways.
Okay, very good.
I've got a ways to go. So thanks so very much.
Thank you, and stay active and stay involved.
Okay, I certainly will. So please join me next Wednesday, April 2nd at 7 p.m. Eastern Time for Senior Nation, when I'll be interviewing Susie Singer Carter, an award-winning writer, playwright, director, producer, and actress. Among her many accomplishments and works is an award-winning documentary, No Country for Old People, inspired by her mother's last 6 months of life in a long-term care facility back in 2022. Susie Singer Carter will share her insights about the country's over 15,000 long-term care facilities and her new initiative known with the acronym ROAR, ROAR, and I'll let her tell you what that stands for. So remember to tune in, comment, and ask questions next Wednesday, April 2nd at 7 p.m. Eastern Time. And until then, take care, stay well, and stay tuned. So this is Phyllis Ayman signing off for tonight. You are listening to Source TV Radio Network, WTSN Washington, D.C., your live streaming all access pass to the arts and entertainment around the globe. Live streamed with global reach and stunning streaming to over 16,000 terrestrial and internet stations, reaching 160,000 DMV viewers and listeners weekly, over 3 million across North America, 38 million globally, in over 165 countries monthly, making Source TV Radio Network one of the highest independent media streaming stations on the East Coast. The network provides listeners with jazz crossover, R&B, and old school music from some of the most renowned artists. Jazz has all but disappeared from radio, but not on Source TV Radio Network. And don't forget to tune in to the Jazz Confusion Power Hour, Thursdays at 7 p.m. Eastern Time, featuring some of the most talented rising new artists and legendary jazz, R&B, soul artists anywhere. Source TV Radio Network, WTSN, Washington, D.C.